Good morning. I'm Martha Maxwell Doyle of the Barnegat Bay Partnership, and together with Gary Sondermeyer of Bayshore Recycling, we are the co-chairs of the New Jersey Climate Change Alliance. I would like to welcome you to today's conversation on advancing health equity in the era of climate crisis. For those of you who don't know us, our alliance is a statewide network of diverse organizations who for the past 10 years have committed to advancing evidence-based, nonpartisan climate change strategies at the state and local levels in New Jersey. We work within and across sectors, and we have produced more than 50 reports on topics ranging from what people, places, and assets are most vulnerable to climate change and why, to identification of policy options, best practices, and climate projections for New Jersey. For example, this alliance commissioned the first science and technical advisory panel on sea level rise for New Jersey, resulting in a 2016 report that was updated in 2019 and has been embraced by state government for planning and regulatory purposes. We provide accessible communication materials and convenings like today, and we've spearheaded the development of decision support tools in New Jersey. I'd like to take this time to thank our sponsors for today's events, including the New Jersey chapter of American Public Health Associations, the Energy Foundation, PSE&G, Bayshore Recycling, NJM Insurance Group, the New Jersey Clean Energy Program, Maser Consultants, soon to be known as Collier Engineering and Design, and the New Jersey Conservation Foundation. I would also like to thank Jean Herb and Marjorie Kaplan of Rutgers University, who co-facilitate the New Jersey Climate Change Alliance, and Matt Drews, who is part of the Rutgers team, helping with the technical side of today's events. Today's event is part of a series we began in the fall as a virtual alternative to our annual conference around the theme of New Jersey, leading the way on climate solutions. The prior sessions in this series are located on our website. Speaking of the chat box, we welcome your comments here today. Today's event will be recorded as well and available on our website. This year, the intersecting crisis of systematic racism, the COVID-19 pandemic, and climate change have come into full view. Issues surrounding health equity have been front and center with our public health work group. We are thrilled to have an exciting lineup of speakers to explore these issues with you. We will first hear from Dr. Marjorie Kaplan, co-facilitator of the Alliance and Associate Director of Rutgers Climate Institute, who will provide some background on climate and health for New Jersey. Marjorie, I'll hand it off to you.
Good morning, Martha. I will do my best to share my screen. Matt, you can tell me if this is working. Let's see. Can you guys see it all?
Perfect, Marjorie.
We're good. Okay, good morning. Thank you, Martha. It's my pleasure to provide a very brief overview of the relationship between climate change and health to set the stage for discussion on health equity at the intersection of climate change and health. This conceptual framework is from the U.S. Global Climate Change Research Program's report on the impacts of climate change on human health in the United States, and it illustrates how climate and health relate. The three center boxes demonstrate this pathway, beginning with climate drivers and their proximate relationship to human health exposure pathways, and the resulting ultimate impacts to human health, noted here as health outcomes. The gray boxes on the sides note other factors that positively or negatively influence health outcomes. For example, environmental and institutional contexts such as changes in land use or ecosystems you'll see on the left-hand side. And on the right-hand side, you see the factors that influence individual vulnerability such as age, gender, race, ethnicity, and housing and infrastructure, poverty level, access to care, and pre-existing conditions. And so as we think about vulnerability to climate change, we think about how different groups are vulnerable based on their exposure, their sensitivity, their ability to adapt, which can all have health consequences. For children, key factors are their immature physiology and metabolism, windows of vulnerability in utero and early childhood, higher exposure per unit body weight to air, food, and water, and their diet and their behavior. Kids just spend more time outside than adults do. Older adults, 65 and older, are at higher risk from heat exposure due to pre-existing diseases and reduced ability to thermoregulate. They can have difficulty responding to evacuating and recovering from extreme events, if they have mobility issues and or if they have cognitive impairment. Vulnerability is also shaped by inequalities associated with race, immigration status, gender, and ethnicity. The intersectionalities between different forms of discrimination and economic disadvantage that contribute to disproportionate vulnerabilities among racially, ethnically, or other marginalized populations is a key consideration in health outcomes. The pandemic has certainly borne this out, and these social vulnerabilities will be explored further by my colleagues this morning. So here's a snapshot of the New Jersey climate drivers in terms of what we've observed and what the projections are. The average New Jersey temperatures warmed about 4 degrees Fahrenheit since record keeping began in 1895. The warming's been more rapid since 1970, with 15 of the 21 warmest years occurring since 2000. And into the future, we expect more warm extremes and fewer cold extremes. Precipitation has increased in New Jersey about 3 inches in the past century, with more of that increase occurring in the last 50 years. And precipitation has increased in the spring and the fall, but winter and summer precipitation has decreased, so there's a seasonality aspect. The overall upward precipitation trend is expected to continue. Models from NOAA indicate a 10% increase in precipitation by the end of this century, but with lack of change of summer precipitation, we expect to see an increase in the frequency of these flash droughts in the summer. Frequency of extreme precipitation events in the eastern part of the country, where we are, is expected to continue to increase in the future. And now talk quickly about sea level rise. Since 1911, it's risen about 1.5 feet on our coast. The rate here is more than twice the global average, primarily due to land subsidence. And projections from a Rutgers-led study find a likely rise of sea level of 0.9 to 2.1 feet by 2050. And sea level rise raises the baseline for coastal flooding, and because of it, we are seeing much more of what we call sunny day or high tide flooding that occurs in the absence of a storm. So this here just summarizes, I'll just summarize for you the various climate drivers, exposure pathways, and health outcomes that are included in the New Jersey Climate and Health Profile Report that the Alliance released back in 2017. It followed the CDC Building Resilience Against Climate Effects, or BRACE framework. And this morning, I'm going to touch upon just a few New Jersey-based examples to set the stage for our discussion on health equity. So for those aspects that I'm not addressing, like vector-borne diseases or harmful algal blooms, I invite you to take a look at the Climate and Health Profile Report for more information. I want to make sure I'm moving. Okay, great. Moderate and extreme heat events already pose a health risk, and climate change increases this risk. Heat-related illness is a spectrum of disorders from minor conditions such as heat cramps to the more severe heat stroke, which can result in death if it's not immediately treated. Heat exposure worsens conditions for people with underlying things like asthma or diabetes. In addition to the elderly, people who work outside or who live in urban areas can be exposed to higher temperatures in urban areas from urban heat island impacts, and they're especially vulnerable to heat. Here we see the number of heat-related illnesses increasing during the warm season. Here it's May through September in this study, in the decade of 2004 through 2013, with respect to both hospitalizations and emergency department visits in New Jersey. I want to also talk about the fact that higher temperatures have air quality impacts. And so here we'll talk quickly about ozone. To clarify, I'm talking not about stratospheric ozone. Stratospheric ozone isn't harmful to us. It protects us from the harmful UV rays of the sun. It protects us from skin cancer and from crop damage. In contrast, ground level ozone is a strong lung irritant associated with pulmonary disease, pneumonia. It triggers asthma. It forms when emissions from industry and utilities, cars and trucks emit nitrogen oxides and volatile organic compounds. And these ozone precursors mix with heat and sunlight to form ground level ozone, which is especially problematic in the summertime due to the high heat. I'll also note that ozone precursors form during wildfires. There is evidence for New Jersey that higher ozone levels have been associated with increases in pediatric emergency department asthma visits statewide during the warm season for the years that this study was done, 2004 through 2007. And with regulation of volatile organics and nitrogen oxides in New Jersey, we have been seeing ground level levels going down. However, New Jersey continues to be in non-attainment for ozone. Note that ozone levels in New Jersey are impacted by emissions from upwind sources in other states, so we are alone not going to solve this. And what about the future? So the prevailing consensus for the Northeast is that ozone projections with respect to future warming cancel out the gains in these reductions if we also don't at the same time reduce our emissions from these ozone precursors that are formed from fossil fuel use for electricity and transportation. And so now I'd like to quickly talk about particulate matter, also known as PM, and it's an important air quality concern, and there is a nexus to climate. Harmful PM are tiny liquid or solid particles suspended in the atmosphere. Inhalation of PM less than 10 microns, known as PM10, can irritate the eyes, the nose, the throat. Fine particulates less than 2.5 microns can get deeper into the lungs and can make their way into the bloodstream, and they're associated with premature death, lung cancer, pulmonary disease, cardiovascular disease, and asthma development and exacerbation. And particulates come from natural and human sources. Human sources include power plants, factories, cars, trucks, construction equipment. And diesel is a particular offender here. Natural sources include volcanic ash, pollen, and wildfires. Now, we hear a lot about forest fires in the West, but I do want to point out that we have them here in New Jersey. And in 2020, the New Jersey Forest Fire Service reported over 1,000 wildfires, which burned about 4,800 acres in our state. The previously mentioned statewide studies of emergency department pediatric asthma events and ozone during the warm season also found a positive association for PM 2.5. PM levels have been going down in New Jersey due to regulation and funding for emission reductions from non-road sources. However, scientists believe the current standards to not be protective enough. How climate change will affect PM 2.5 in the future is not clear. For example, on the one hand, things like heavier rain events may reduce particulates, while warmer temperatures and drier conditions can help wildfires spread once they start, and warmer, drier conditions also contribute to the spread and survival of insects that can weaken or kill trees, building up the fuels in a forest. So right now, it's unclear if there will be a net increase or a net decrease. I'll touch upon storms and precipitation changes and sea level rise impacts. Direct and indirect injuries can include fatalities from drowning, hypothermia from staying in a house with no power, falling down darkened stairs, misusing diesel generators, missiphoning gas, being struck from downed trees. Flooding or power outages disrupt healthcare systems and medical offices. There's a lack of access to medication, or medications are rendered inviable from lack of refrigeration. Power outages can lead to food spoilage, to pressure loss in water utilities that can allow contaminants to enter the drinking water system, and to pump failures at wastewater utilities, which can result in untreated sewage discharge to water bodies or back up into homes and businesses. Too much or too little water can damage crops, reducing food supply. Cattle and other animals can get into flooded areas and contaminate crops. And as sea level rises and increases coastal flooding, there is the risk from contamination to soil, farm ponds, crops, and groundwater from saltwater overwash and tidal flooding. Sea level rise also elevates the water table in low-lying coastal areas, and in heavier rainy periods, we see areas along the coast where there's standing fresh water that cannot drain into the ground, and hence more flooding. Sea level rise will move the shoreline landward, thus similarly moving the freshwater saltwater interface landward, potentially increasing salinity in drinking water wells just inland of this transition zone. And so finally, some of the evidence we've seen in New Jersey on health impacts from extreme rainfall and storms here. There are data reporting a positive association between hospitalizations for GI illnesses and extreme rainfall in the state during the warm season. Post-Hurricane Sandy studies found significantly increased rates of emergency department visits and hospitalizations for management of chronic conditions such as COPD, asthma, and diabetes just after Sandy, with rates higher among women in poor and minority neighborhoods and in communities of lower socioeconomic status. The most frequent reasons for calls to the New Jersey Poison Control Center immediately preceding, during, and after Sandy were for gasoline and carbon monoxide exposures, followed by concerns about food poisoning, spoilage, and water contamination. Studies reported mold in the homes of residents post-Sandy, and those exposed to mold were 2.5 times likely as those not exposed to be diagnosed with asthma after the storm, and twice as likely to report mental health distress. And lastly, data show that children living in homes that experienced minor damage were at particularly high risk for psychological and emotional issues, and point to the need for pediatric and social service communities to be particularly attentive to children's living environments and consider homes with minor damage as well as homes with major damage. So I want to thank you, and I am going to stop my sharing and turn it over to Martha.
Thank you, Marjorie, for this helpful background. Now I'd like to invite Donald Weinbaum, President of the New Jersey Public Health Association, to join us. After Don provides perspective on climate change on behalf of the New Jersey Public Health Association, he will introduce today's feature speaker, Ms. Surili Patel, to join us from the American Public Health Association, of which the NJPHA is an affiliate. Take it away, Don.
Thank you, Marjorie. And good morning. I'm Donald Weinbaum, President of the New Jersey Public Health Association. On behalf of our association, I'd like to thank the New Jersey Climate Change Alliance for inviting us to partner with them today. Climate change is an emerging area of focus for our organization, but that does not mean that it's insignificant or that it's of relatively little importance. In fact, the impacts of climate change on public health will almost certainly increase dramatically in coming years and eventually affect virtually all areas that relate to the public's health. COVID-19 has brought into focus how critical public health is to New Jersey and the entire nation, not just with respect to disease prevention and health promotion, but to maintaining a functioning society and a healthy economy. Many of us are focused right now almost entirely on COVID-19, but we cannot forget other things that are happening in the world. The past year has been unusual in some ways, but looking back at the lessons learned may offer some guidance on how New Jersey might plan for the growing impacts of climate change. I'll circle back to that in a few minutes, but first I'd like to tell you a bit about our organization. This year is our 145th year at NJPHA. We are an affiliate of the American Public Health Association and one of the oldest state public health associations in the nation. Our roots go back to 1875 with the founding of the New Jersey Sanitary Association. NJPHA's mission is as follows: to provide leadership in ensuring optimal and equitable health for individuals and communities through educating the public and health professionals, and advocating for developing public health policies that result in equitable and optimum health for the public in New Jersey. We are 100% volunteer, which sometimes limits how much we can do to achieve these goals. But it also means that we are not constrained in what we do or what we are able to support. In this regard, NJPHA has adopted a set of core values and principles which guide our efforts. I'd like to share them with you because several of them are especially relevant to our discussion today and to why we are co-sponsoring this event. NJPHA's core values include advocacy, education, equity, professional development, collaboration, responsibility, and that means for government, individuals, communities, and professionals alike and sustainability, and specifically that environmentally and economically sustainable communities are critical to ensuring good public health. NJPHA's membership spans the governmental, nonprofit, academic, and community sectors and includes professionals, students, and organizations with a shared interest in promoting health, preventing disease, and protecting the health of the state's population. We currently have 2 student chapters and are hoping to add more. I mentioned collaboration. Collaboration is key to much of what we do today as an organization. Clearly, there is strength in numbers, but collaboration is also about building bridges and finding common ground. It is about speaking with a unified voice when possible, but also about respecting the expertise and experience of others. Climate change is one such area. NJPHA is pleased to be part of the Rutgers Climate Institute's Public Health Working Group on climate change. I believe you'll hear more about the group's activities later in today's program. The work they're doing is critical and hopefully will set the stage for development of New Jersey's action plan on climate change and health. Other organizations we're involved with that touch upon aspects of this issue include Sustainable Jersey, which focuses on community and local government approaches to conservation and reduction of emissions. Delaware Valley Regional Planning Commission, which has a Healthy Communities Task Force. The region served by DVRPC includes 4 counties in New Jersey: Burlington, Camden, Gloucester, and Mercer. The New Jersey chapter of the American Academy of Pediatrics, which is providing leadership and establishment of a state organization of clinicians for climate change. And the membership in this group is not limited to pediatricians. It's being established now, so if anyone attending today is interested, we can put them in touch with the group. The Union of Concerned Scientists, the New Jersey affiliate or chapter, where several New Jersey members are involved with climate change awareness and advocacy. And NJPHA also was part of the Health Impact Assessment Advisory Group that provided comments on New Jersey's Energy Master Plan in 2019. In the past year, NJPHA has started collaborating with the 4 neighboring state public health associations in HHS Region 3, which established a Mid-Atlantic Regional Public Health Partnership. Technically, New Jersey falls in Region 2, but as our state straddles the Philadelphia and New York metropolitan areas, we have discovered that our state associations are dealing with similar issues. Not surprisingly, there are also differences between states with respect to resources, readiness, and governmental priorities. Climate change and health might be an area where we can learn from each other. I would be remiss if I didn't mention that NJPHA is a member of PHACE, P-H-A-C-E. That stands for the Public Health Association's collaborative effort. PHACE is a consortium of the 6 statewide public health organizations in New Jersey, several of which are also involved with climate change planning and advocacy. There's every reason to believe this list will grow longer over time. Relationships such as these are critical and provide opportunities for advocacy, engagement, and coordination. As I was making the list, it struck me that there is one key question we should be asking ourselves. Who is missing from the list and from the conversation? And I share that with you today because it seems especially relevant to health and climate change planning and to maintaining equity in all that we do as a state. I'd like to speak briefly about why climate change is a concern for NJPHA and for me professionally. Clearly, it is a major priority of APHA and one that NJPHA and other state affiliates support and advocate for. But more importantly, its impacts on New Jersey are undeniable and will only grow in future years. All we have to do is turn on the TV or listen to the weather reports to know that our state and the rest of the nation is experiencing more extremes in weather and more variability. But connecting the dots and increasing public awareness about the science and implications of climate change may not be quite so easy. Getting buy-in and changing behaviors will be one of our challenges. And I have to say, for those of you who think I'm showing my age talking about TV and radio, yes, I am. Today, we clearly live in a digital world. Technology has greatly increased opportunities for sharing information, but often what people see on websites or through social media is limited or biased. The algorithms on many websites and social media platforms actually are configured to display content similar to what has already been viewed or searched for, meaning that there is an inherent bias. So it creates a narrow view of reality and can limit access to data. New Jersey is clearly experiencing changes in climate. Marjorie's talked about that. She's talked about the facts and the science. It's quite compelling. This is our starting point. We are seeing more tornadoes, warmer winters, more variability in storm intensity, and increased flooding. Marjorie mentioned Superstorm Sandy. Some parts of the state are still recovering from Sandy. And 100-year storms no longer come every 100 years. 200-year storms no longer come every 200 years. There's one plus side. There may be other plus sides, but farmers are now enjoying longer growing seasons. The facts are compelling, and there are many climate drivers. The longer term and health-related effects of climate change are more subtle, not always perceived by members of the public, but they are equally real. They include, but are not limited to, invasive species, heat-related illness, respiratory conditions, contaminated water, and there's a much longer list than that. There's a great deal of information available on this subject, and hopefully there will be more moving forward. Increasingly, public health, especially what we refer to as public health 3.0, is about looking at and addressing social determinants of health. Robert Wood Johnson Foundation has done much to call attention to the significant differences in health between neighboring communities and to try to mobilize people to act. A few miles can mean a difference of 15 to 20 years in average life expectancy. That is true here in New Jersey, and it is true throughout the United States. Unfortunately, unless we take deliberate actions to address them, some of the impacts of climate change will be disproportionate and will aggravate these health inequities among disadvantaged citizens and communities. To give just one example, a recent analysis by Climate Central indicated that 5 of New Jersey's towns are among the top 20 communities in the US vulnerable to significant loss of affordable housing due to flooding. These include Atlantic City, Hoboken, Camden, and the smaller cities of Salem and Pennsgrove. Some of you may know that the first annual meeting of the American Public Health Association was held in 1872, right here in Long Branch, New Jersey. It is not entirely clear what APHA will find if it comes back to New Jersey to celebrate its 200th anniversary, especially if we fail to recognize the risks of climate change and to take appropriate actions. All indications are that in 50 years, portions of many New Jersey shore communities will be underwater or subject to frequent flooding. The past year's experience with COVID-19 suggests that planning, investment in infrastructure, early intervention, public education, and coordinated response need to be key components of preventing or mitigating pandemics. I would argue that the same applies to climate change. Building trust and empowering those who have historically been marginalized will also be critical. If we don't talk about social justice and environmental justice, it is much less likely to happen. So I'm glad that we're here today talking about this issue, and I hope that this is the first of many such presentations and conversations. On that note, I would like to introduce my colleague, Surili Patel, who's our keynote speaker. Surili is director of the Center for Climate, Health, and Equity at the American Public Health Association, and also serves as deputy director of APHA's Center for Public Health Policy. Her role bridges development of public health programs and sound public health policy. As director of the Center for Climate, Health, and Equity, he also works to inspire action and advance policies that address health at the nexus of climate and equity. I'm excited to welcome Surili to New Jersey. I'm looking forward to her presentation today. And I'll turn it over to Surili now.
Hi, everyone. Good morning. Thank you so much for that introduction and for the very helpful context-setting comments by Marjorie and Dawn. I'm so honored to have the invitation to speak to you guys today, and I'm so glad to see this important learning opportunity take place in the face of our new reality of physical distancing. Again, my name is Surili Patel, and I'm with American Public Health Association. And I wanted to start off with a bit of a story that riffs off of a childhood parable that has sat with me for a very long time. Let's see. The story begins on the 5th day of an intense heat wave. Suddenly, clouds appear at the eye level across a densely populated city. 3 people from 3 different neighborhoods of the city were elected to investigate how the inescapable heat and suffocating air were linked and what could be done. The first person came from a well-to-do community and had a chauffeur drive them in a car. They were both, while shielded from the extreme heat, still experienced the dark clouds obstructing their visibility through the car windshield. The second person came from a densely populated community where people rolled on bikes, scooters, or skateboards. And that person hopped onto their bike and took off to investigate. Their visibility was certainly a problem, but so was the air quality, which made it harder for the cyclist to get enough oxygen to pedal, not to mention the extreme heat they were experiencing. The third person came from a community that relied on public transportation, but since their search led them outside of the city limits, where there was no public transportation options, this person set off on foot. The visibility, poor air, and extreme heat immediately affected the walkers' journey. And since they were on foot, it took longer. And so their exposure to the elements was also prolonged. After a while, the 3 of them converged on the same path. And due to their limited visibility, they didn't know where how the others got there. But they all agreed that the heat and the clouds were too much for them and their communities to bear, and something must be done. Together, they continued forward on the path before them and soon stumbled upon a large, unknown obstruction on the road. The obstruction was so large that they couldn't continue on the path together and decided to split up and come together on the other side to share what they found. First went the car. They were able to weave through the obstruction, almost making it to the front, but were stopped by a big puddle. It appeared to be a large spout of water flooding the path before them. But because they were in a car, they simply drove right through it and thought how nice that cool water must feel against their hot skin, or how it could be used to quench their thirst. Though, because of the diminished visibility, both the driver and passenger couldn't quite gauge the depth or the width of the puddle. And it didn't matter because they were in a car. The cyclist followed behind slowly. They had to stop, unfortunately, to seek refuge as a large pillar-like structure to offer shade. The cyclist thought about how their active community might enjoy breaks from the heat too if more pillars were erected throughout the neighborhood. And the walker on foot decided to climb over the obstruction to get out of the eye-level clouds, taking pause at the top of the climb to realize that The higher the altitude, it might have solved the air quality issue, but the heat became more intense. Finally, when they reached the top, the walker discovered a breeze passing through and wondered if somehow the breeze could be bottled up in an indoor area that others in his or her community could enjoy. By the time each of them made it past the obstruction, they all had their minds made up about what their respective neighborhoods needed to seek reprieve from the heat and pollution. First, the passenger proudly said the solution would be to open up spouts like the one they came across for recreation during those hot days. But the other two asked, how would the water be turned off once it started to pour in? The passenger didn't bother wondering about the consequences of excess water. Since their neighborhood, everyone had a car and some even had drivers, so they could just drive around or through any excess water. The cyclist conclusively said next that the only solution is to plant tall, leafy trees where bicyclists can take breaks on their journey. The car passenger immediately objected because the trees would take up valuable real estate that could be used for roads and parking lots. The person on foot, the walker, asked how their community could also get trees, but nobody was really listening. The walker hesitantly said that the breeze felt at the top of the obstruction felt nice, as a nice gift to give to those who otherwise wouldn't have access to natural or manufactured cooling. The walker also identified the need to expand the public transit system so that he and his neighbors can also access points in the city that offer cooling. The first two ignored the suggestion because they knew their tax dollars would be going to an effort that they themselves would not benefit. Rather than taking a step back to identify and name the entirety of the obstruction, as well as learn from the other's solutions on the same path to discovery, each person focused on the problem and the solution directly before them to benefit themselves alone and their communities. The original parable, the teaching that has stayed with me for the longest, has been that the failure to understand other truths will be our greatest limitation to realizing the whole truth. Now, I know there's a lot to unpack in this version of The Elephant and the Blind Man, but I hope you at least walk away with some of these observations that absolutely must be applied during the climate crisis, as it's a matter of our health, especially for those that are the most climate sensitive. It's so critical that we take a moment to look at the big picture, take a step back, and not focus on the immediate problem and its potential solution. And that we take a moment to learn from various perspectives and disciplines so that we can work together. And of course, there are potential and obvious solutions that come to mind, but just to take a moment to recognize that there may be unintended consequences for other groups or neighborhoods. At the American Public Health Association, the Center for Climate Health and Equity leads public health efforts to inspire action on climate and health. We advance policy and try to galvanize the field to address climate change. But climate change is the biggest threat to our health, and we must find multi-pronged intersectional solutions. We heard some New Jersey specific examples of these climate effects, but I'll just pause to say and recognize that climate change poses an unacceptably high and potentially catastrophic risk to human health, to our communities, to our neighborhoods, and even more so to those, even more so to those that are climate sensitive. And of course, we're all observing the mental health impacts of climate change. Some immediate impacts, like the natural disasters that were discussed and that some of you may have experienced firsthand, are sudden in their onset and often include destructive storms, floods, wildfires, and extreme heat. The natural disasters may cause this potential for post-traumatic stress disorder, anxiety, depression, and stress. And this could lead to self-harm, including substance abuse or suicidal ideation. And then there are gradual impacts of mental health, where they come slowly from progressing long-term conditions associated with climate change, including rising temperatures, elevated sea level, and changing in precipitation patterns. Chronic stress from the gradual change can happen. And this can happen from examples like infectious diseases or chronic illnesses like asthma or allergies, nutritional deficiencies, and injuries that can contribute to stress. And we've learned that exposure to stress over long periods of time can affect a child's academic achievement. In the indirect impacts of climate, we're seeing that we think differently about ourselves and each other and the world. After a climate event or resulting displacement, perhaps, people may experience a diminished sense of self, have difficulty relating to others, and diminished social interactions. And community impacts include domestic abuse sometimes, and child abuse or violence. And this includes assault and civil conflict. And of course, the economic insecurity and physical damage of other potential effects. These challenges in mental health and behavioral health are exacerbated in communities of color and communities of low wealth. Yet we're not defined by the singular problem. It's not just climate change. Never before have we seen co-occurring crises wound the country and the world, while simultaneously unearthing deeply rooted social and racial injustices. The short and long-term health implications of climate change, COVID-19, and the movement for Black lives beg the need for action that addresses all aspects of harm brought upon the people of this country. Not acting on the basic threats to human health in a unified and holistic way is not an option anymore. Climate change exacerbates health inequities. The political, economic, social, and environmental resources enable people to cope with climate threats, such as extreme heat or natural disasters. But difficulty in accessing these resources can contribute to potentially unmanageable health burdens as climate continues to worsen. So let's talk a little bit about these co-occurring crises. I find it hard to talk about justice and equity without first discussing racism, something that began so long ago and is sometimes just accepted as is. Let's start with exploring how racism affects us, and in particular, our health. Here are some definitions that you may have heard and that offer great insight into our discussion. Racism, in essence, offers opportunity and assigns value based on the color of a person's skin. So to oversimplify, racism inevitably drives people into multiple categories with various levels of benefit and disadvantage. And since there are various groups that experience racism, but many experience it differently. The tricky part about this is that racism may be applied intentionally or unintentionally. We're not born with racial biases. It's baked into our systems and policies, which then offer opportunities and disadvantages to achieve good health because they were designed by people with both implicit and explicit biases. And since racism is a driving force of the social determinants of health, like housing, access to food and physical environment or community, it's important to lift up the notion that environmental racism has systematically, both intentionally and unintentionally, put people of color at an unfair disadvantage. Environmental racism is the disproportionate impact of environmental hazard on people of color, often without their input. According to Dr. Robert Bullard, environmental racism encompasses an environmental policy, practice, or directive that differently affects or disadvantages individuals, groups, or communities based on race or color. So these are the same reasons that those who face environmental racism and disproportionate burden of COVID also face the disproportionate burden from climate change. To sum up these symptoms, communities hit hardest by COVID-19 lack access. They lack access to quality healthcare. They lack access to clean air. They lack access to capital. They lack access to safe, affordable, and nutritious food, and certainly lack access to safe, affordable housing options. So why can't we solve this with a doctor's office visit or a prescription? That's because 20% of what it takes to attain good health comes from health care or medical care. The other 80% that impacts one's ability to achieve good health comes from those social and structural determinants of health, as discussed earlier. So we're talking about education, income, housing, food, medical care, outdoor environment, community safety, to name just a few. Such inequalities are created when barriers prevent individuals and communities from accessing these conditions and reaching their full potential. So let's talk solutions. It's so important that we focus on policy, but there's more that we can do. So let's first talk about policy. Promote policies focused on environmental justice and health equity that are designed to address climate change adaptation and mitigation for all, that enable an environment and a culture in which the climate healthy and equitable choices are the easy and accessible choices. Let's respond to the needs of the public health professionals by working to augment training through JEDI training and racial equity. And when I mean JEDI, I mean justice, equity, diversity, and inclusion. Let's make sure that public health professionals have the opportunity to grow and build cultural competencies when they're working with communities. Let's influence the practice by quantifying health impacts to support culture of change, to prioritize human well-being. And let's speak out. Let's lend our voices as experts and partner with local media, partner with government, partner with academia. Let's talk. Let's talk and lend our expertise out. And of course, hold officials accountable, whether they're elected, appointed, or earned their position and rank. Let's hold them accountable. A lot of these community-based services, public goods, are for us all. And the people put into leadership positions should be held accountable, especially the electeds. It's not enough to just cast a ballot. It's equally important to make sure that they are living up to their promises. Equity is held central to climate action. It must be held central. Climate change threatens everyone in the US, but there is a bit more immediate danger to some. And climate change exacerbates health inequities, disproportionately harming the most vulnerable among us. And some communities experience systemic neglect, environmental racism, and have the least responsibility for climate pollution, but are the most affected. The actions we take now will determine the scale of climate impact on the health of our children and our grandchildren. The call to action that you see on the screen stresses that we need right policies and we need to invest in them today. We have to prioritize and take opportunity to realize our vision for healthy people and healthy places on a healthy planet. So here are some climate actions for health. Something New Jersey could do is emphasize active transportation where it's possible so that transition to zero carbon transportation systems is in the near future. And then promote healthy, sustainable, and resilient farms and food systems, forests, and natural lands for folks to enjoy, but also to remain sustainable. And then the call to action also talks about health actions for climate. And one that I'll call out that is relevant here is to engage the health sector voice in a call for climate action. Health is such a unifying topic, as polls have shown us. And so we're where the rubber hits the road. It's really important for public health practitioners to lend a voice to talk about climate action in a meaningful way for their community. And of course, we need to invest in all this work. So let's allocate resources that enable health sector to effectively protect health in the face of climate change, starting with the support of local and state health departments, and to build resilient hospital infrastructure. I encourage each of you to check out the full call to action and learn ways you can get involved. So here's a more specific example pulled from the 2020 Lancet Countdown Brief. As Marjorie pointed out, New Jersey residents face extreme heat and impacts of air pollution. We don't live in the singular, like I said before. And so there needs to be multiple approaches to the solution. This means we need to think outside of the health sector. We need to address agriculture sector, where climate action can implement sustainable regenerative practices. We need to engage the energy sector, where we can transition to zero carbon sources of energy. And we need to engage the transportation sector, so we can expand affordable and safe zero carbon options, including active transportation like biking. But there's a cautionary component to all of our zeal. Like the three people in the parable I described earlier, all of them were set out to find solutions for their communities. But the cautionary is there may be unintended consequences. So since I'm a public health wonk like you, let's talk about solutions through an equity framework. When we're talking about procedural equity, as a reminder, we're talking about fairness in the political process and participation in the decision-making process. So looking back at the version of the parable I described at the top, the three individuals exploring to find solutions for their respective neighborhoods wanted to be part of the decision-making table, albeit each with their own solutions in mind. So when we think back, the biker asked for more trees. Immediately, there was a discussion. The passenger said, no, it's going to take up too much real estate. And the walker said, yes, that would be great for those on foot and taking public transportation. The three of them were able to discuss it because they were at the table. Then there's distributive equity, which highlights the need to consider not just the allocation of benefits, but also the burden. Let me say that again. We can't just focus on the benefits of a strategy, intervention, or solution, but we need to talk about and consider the burden. So when the driver in the parable said that the water spout option would be the best for their community, the other two people in the story spoke up and said, well, hang on, you may be able to drive through or drive around the water if it gets too deep or comes down too fast. But we can't, because we don't have cars. We would have to walk or roll or bike through. And that might not be feasible for everyone in the community. So there are some undue burdens to that solution. And then contextual equity recognizes that the playing field is never leveled. The three people that went out to find a solution all came to that realization because their community were affected the same way, but their approaches were different because of what resources they had. It's important that we realize that the people's ability to access resources and power determines their ability to engage in the process, whether it's political or decision-making, so that they can speak for themselves to determine the best distributive outcome. So let's talk about some health-specific solutions. I have examples for you. I would be remiss if I didn't share this image created by EPA and was also shared in the 4th National Climate Assessment, where it talks about health equity. talks about disproportionate burden of climate change. While we all feel the health impacts of climate change, some will feel it the hardest, and some will not be resilient to them. They are the young, the old, the poor, and the different. Let's break this down just a little bit. Children, for example, breathe more air and drink more water per body unit than adults. So they inherently are exposed to more in a shorter period of time. And their also behaviors are different. They're also shorter and smaller. And so they breathe in air differently. With older adults, they may have low immunity or pre-existing conditions that make them already sensitive and vulnerable. And then may also have limited mobility to escape or prepare for an oncoming climate event. And then there's communities of color that may lack social capital and sometimes work with a language barrier that make it more challenging to get news in a quick and effective way. Low wealth communities, and I call this low wealth versus low income specifically because it's not about a person's ability to achieve a livable income. A livable wage is so important, and I'm not saying that should be discredited. When we're talking about the community level, we're talking about low wealth because there are less resources and means to perhaps evacuate because the infrastructure may not be adequate, or there may be physical damage to the community. There may be less resources in the community through divestment in places to cool, like tree canopy, or even public spaces like schools or libraries. And then there may be food and water insecurity that may be attached to food deserts, and also trust with the government and water, the safety of drinking water. There are several climate sensitive groups that are not mentioned, and some of them include those who experience homelessness, pregnant people, student athletes, migrant and outdoor workers, those experiencing disabilities, those that are incarcerated or recently incarcerated, and so many more. So it's so important that we visualize a Jedi healthy future. And language is so important because words give us power. Let's speak truth. We need a Jedi approach, justice, equity, diversity, and inclusion approach to climate and health solutions. When we talk about climate justice, we're really talking about the protection of the rights of certain groups like children, older adult, low wealth communities, and communities of color that are less climate resilient or face higher climate risks and therefore more vulnerable to negative health impacts of climate change. When we're talking about health equity in this context, we're talking about the notion that everyone has fair and just opportunity to be as healthy as possible. And this requires the removal of obstacles to health, such as poverty, discrimination, and their consequences, including powerlessness, lack of access to good jobs with fair pay, quality education and housing, safe environments, and healthcare, and more. When we talk about diversity in this context, we're talking about the physiological, physical, social differences that occur among any and all of us, including but not limited to race, ethnicity, nationality, religion, socioeconomic status, marital status, education, language, age, gender, sexual orientation, mental or physical ability, and learning styles. A diverse group community organization is one in which a variety of social and cultural characteristics exist. And lastly, inclusion. Let's talk about the act of creating environments in which any individual or community can be felt welcome, respected, and supported so that they can feel valued and fully participate in authentic work. An inclusive and welcoming climate embraces differences of other perspectives and thoughts, perspectives that we can all lean on when we're trying to find solutions to this big obstruction of a problem. I have for you an example from California. CalBrace on how they went about defining vulnerable populations while considering gender, race, ethnicity, and income, and looking into existing environmental justice communities. They have statutory language for vulnerable populations, which I'll read to you. Vulnerable communities include, but are not limited to, women, racial or ethnic groups, low income and families, individuals who are incarcerated, those with disabilities, those living with mental health conditions, children, refugees, and more. And vulnerable places, it's not just the people, but it also could be the places where we want to consider includes communities with inequities in social, economic, educational, or physical environment or environmental health that have insufficient resources or capacity to protect and promote the health and well-being. So part of identifying vulnerability is identifying the social determinants of health, but also the places that these determinants are taking place or lacking. They've talked about environmental exposure, population sensitivity, and adaptive capacity. When they're looking at environmental exposure, they really honed in on extreme heat days, air quality, specifically PM 2.5, and ozone levels, drought, wildfires, obviously, sea level rise in the coastal areas. When they defined population sensitivity, they focused in on children, elder adults, poverty, and education. And they also looked at percent of people of color, outdoor workers, vehicular ownership, and linguistic isolation, to name a few. And examining their adaptive capacity, they looked at percent household without air conditioning, percent area not covered by tree canopy and impervious surfaces. So CalBrace has a Healthy Community Indicators project and climate change and health vulnerability indicators that provides a standard set of statistical measures and data and tools on social determinants of health in California, including some income security, food security, and nutrition. So using the quantitative adaptive methodology for assessing vulnerability, they looked at the most intensive work, which was at the community level. They looked at Toolville and Tulare County of 80 households to develop a vulnerability assessment using indicators most important to the community. And they came up with a vulnerability assessment in partnership with local health departments. So they collaborated methodology for the assessment and also did the data collection in multiple languages. So to kind of step away from the California example, to address climate and health, we really need to work both horizontally and vertically, and that was demonstrated in the California example. When we're talking about horizontally, we're talking about fostering state and local health department relationships, creating partnerships with local health departments that may be more connected in the communities they serve, and then also looking inwardly to health departments, whether state or local, to look at other connections to communities not in environmental health, maybe in emergency preparedness or maternal child health. And then working with academia to support research and benchmarking, because that's equally important to identify where we can prioritize human health, and we can strengthen partnerships to bring more to the table. And then, of course, strengthen community partnerships to build partnerships with underrepresented frontline tribes and communities that are protecting land with various energy interests or land interests. So it's so important to reimagine JEDI when it comes to climate change. According to a recent study or a recent transition document for the Biden-Harris administration, there are several key steps that can be achieved to bring us closer to promoting health and equity in the climate action space. There are a few that can be encouraged at the state level even. We can declare climate crisis as a health emergency and restore science and scientific integrity we can make environmental justice a top priority for climate action and build climate and health resiliency and integrate health and health equity in all climate policies and investments across the whole of government. I have a few slides on energy as a solution. I'm going to skip over them, but make these available to you. And if we have time in Q&A and you're interested, I'm happy to go through them in a little bit more detail. I want to take a moment to talk about partnerships and the value and the importance of partnerships when we're working. We did talk about the community level partnership, but it's also important to talk about developing education and communication so that we're all on the same page. Like I said earlier, language is so key. It's so important. So we can all speak the same language and the same jargon. It's so important that we advocate for policy change. Whether you can advocate with a capital A or educate, it's still important to lend your voice. A picture is open to interpretation, as I kind of alluded to in the parable earlier. So as health and public health professionals that protect some of the most climate sensitive, it's our responsibility that the picture is accompanied by a narrative that includes the whole truth. That means we're focused on the multi-solving. The convergency of the co-occurring crises, or the syndemic, some would say, need public health solutions to address climate change, social and racial inequities, energy and economic injustice, and the global pandemic. Here's a set of national level recommendations put out by the 2020 Lancet Countdown on Climate and Health Brief. Let's transition to healthy, sustainable agricultural practices, to implement policies and invest in programs that can foster and improve health from a reduction in particulate air pollution and greenhouse gas emissions, such as reducing nitrogen fertilizers. Let's remove US fossil fuel subsidies to eliminate and reduce investments in new energy exploration and production. Let's think about shifting to zero carbon electricity urgently so that it's affordable for all, and increase access to healthy transport options by investing in and enhancing infrastructure that's affordable and accessible, including zero carbon public transportation, electric vehicles, and charging stations. Let's strengthen public health systems with increased sustainability and sustainable investments that protect against the accelerating health threats of climate change. And last but not least, and I think this is so important, invest in health recovery from the COVID pandemic that will implement a quadruple benefit of COVID recovery plan that works to stabilize the climate, protect public health, promote sustainable economy, and creates an equitable society. Coming later this year, APHA is working on a climate change and health equity playbook. The idea of the playbook is to emphasize the work that health departments are doing to provide programs, resources, and partnerships and services to diverse communities on a range of mental, behavioral, and environmental health needs. The playbook is geared towards state, tribal, territorial, and local health departments that are addressing the urgent need to adapt to the health impacts of climate change. CDC's Building Resilience Against Climate Effects, or BRACE, framework was created to navigate the health adaptation process. And so this playbook is a supplement to the BRACE framework to amplify, incorporate JEDI. And due to systemic challenges, biases, and lack of resources, JEDI is not often a leading emphasis in health adaptation planning across the country. And although BRACE requires identification of sensitive populations and encourages public health departments to consider JEDI in their adaptation planning, there's a need for a more comprehensive tool to support users exploring JEDI-related challenges and infusing these principles more intentionally across climate and health resilience efforts. So it, in essence, focuses on the social and structural determinants of health we talked about today. And that's incredibly important. Offering demystifying JEDI provides an opportunity to transform environmental, socioeconomic, and health disparities across the country so that we're not applying a lens of JEDI, but we are infusing JEDI. It's without option. The playbook will include 3 sections. The first, which is a 101 on JEDI embrace, a section on step-by-step recommendations for adapting to climate. And the last section is brace in action with the JEDI. And really it focuses on how we can understand the progress that some states have already made. So this is forthcoming, and I hope that it may be a great asset for the New Jersey application to the BRACE program, because it would be instrumental. And even if you don't get selected, it still offers a lot of helpful tips and tools for the state to take on, so that we are looking at JEDI centrally. So I see that I have time. Thank you very much for all the work that you do to protect the people of New Jersey from these devastating co-occurring crises, and for your bravery to stand against the poverty of imagination. I'll leave you with 2 quotes from the poet Amanda Gorman, stitched together from 2 separate poems. We've learned that quiet isn't always peace. And there's no rehearsal. The time to act is now. Thank you very much. And I'll turn it over to Martha.
Thank you so much, Surili, for your wonderful and thought-provoking talk. It is now my pleasure to invite Jean Herb, co-facilitator of the New Jersey Climate Change Alliance and executive director of the Environmental Analysis and Communications Group at Rutgers University's Blaustein School of Planning and Policy, to join us.
Thanks
Gina,
so much. Oh, go ahead, sir.
That's all right. I'm just going to say, you're going to provide us with an overview of New Jersey, the Alliance's activities on public health. Go ahead.
Thanks. Thanks. I'm so excited to be here.
All right.
Thanks so much, Martha. As Martha said, I'm going to just take a couple minutes and bring everyone a bit up to speed on some of the work that's been happening here in New Jersey. And so that you can all, look for opportunities to be part of the solution along with other participants in the Alliance. I'm pleased to report that I think that this work is tremendously consistent with many of the themes that Surili outlined, including the JEDI approach in terms of justice, equity, diversity, and inclusion. And I think you'll see that clearly in our work. So as Martha mentioned, the Climate Alliance is a decade-old network of more than 60 organizations that work together to take science and evidence and informed dialogue among diverse participants to outline action in New Jersey. Public health and climate and health equity has been a very strong focused area of the Alliance's work for the past 5 years. And we're pleased to report that the Climate Change and Public Health Work Group of the Alliance has been a very active group that creates a strong foundation for big action here in New Jersey. That work group is chaired by George D. Fernando and David Henry, who will be joining us today on our panel and Q&A conversation. And the participants in the Alliance's work group include all of the organizations that participate in FACE, which Don Weinbaum explained is the Public Health Agency's collaborating effort, as well as Healthcare Without Harm, as well as the New Jersey chapter of the American Academy of Pediatrics, and then also others who are not necessarily in the health sector, but who are in other sectors, recognizing that health and work on transportation or work on conservation or work on energy go hand in glove, as Surili discussed, with health outcomes and health equity. So I'm going to just sort of give you a little bit of a grounding so you have some sense of work that's been done and work that's currently going on. So on this slide, what you'll see are just a couple of the products from the Alliance. So as Marjorie mentioned, in 2017, the Alliance took it upon itself to undertake the first step in the Centers for Disease Control BRACE framework, which is the development of a climate and health profile report. And I earlier put the link to that report in the chat box. So this was the purpose of the climate and health profile report is that it allows us to essentially frame what we anticipate using the best science and evidence available, what we expect some of the biggest health impacts to be here in New Jersey. So it's somewhat quantitative to the extent that there's data available. It also strongly recognizes that certain populations are, and certain communities are more affected by changing climate conditions than others. What the Climate Health Profile Report did was it outlined 5 steps: act, plan, assess, support, and build capacity for action in New Jersey. And essentially what this work involved, and I'll take 2 minutes and just explain. So the concept of ACT is, yes, we need to always consider looking at new data and new trends and understanding disease burden. But we have enough information now to act and to advance state and local policies to address climate change impacts, health impacts from climate change. The second is plan, which is the concept of integrating, considering climate change as part of health planning, whether that's local county health improvement plans or health systems, community health improvement plans, community health needs assessments. And it also means then considering health as part of climate planning, right? So it goes back and forth. Think about climate as part of health planning. Think about health impacts, particularly health equity impacts, as part of climate planning. The third is to assess, which means to continue to track trends, to better understand the disease burden and the impacts here in New Jersey. The fourth is support, which is to build the kinds of tools and guidance that the public health community and others here in New Jersey need to be able to act. And then finally, the last is build capacity, which is to recognize in New Jersey the constrained capacity of our public health infrastructure and recognize the tremendous burden that addressing climate change adds to that already constrained capacity, and being able to ensure that the public health community has the capacity they need to be able to become leaders on climate change and public health work. So that's kind of the framework that the Alliance outlined. We've also done a tremendous amount of education. This in the lower left just shows you one video we've created. It's a great video that is just a great 101 on climate change and health in New Jersey. And all this work led the Alliance to receive the 2017 Public Health Advocates of the Year Award from the Local Boards of Health Association, which we're tremendously proud of. So some of the other things that the Alliance has been involved in is one topic area, one theme that has been a very strong aspect of what the Alliance has laid out for action in New Jersey is the concept of assessing, better understanding what health and health equity impacts come from our climate decisions here in New Jersey. So the idea here is before we make climate policy decisions, or energy decisions or transportation decisions that are intended to drive climate solutions, we need to really think about and predict the health outcomes and the health equity outcomes, because then it'll give us the opportunity to mitigate those decisions so that we can ensure really great health outcomes and that we don't deliver bad health outcomes. And so in that regard, the Alliance, along with a lot of folks from the Public Health Work Group and the public health community, developed up here on the left is a rapid health impact assessment. This is a demonstration, a rapid health impact assessment of the draft New Jersey Energy Master Plan. And that was actually submitted by the Alliance during the comment period on the draft master plan. We're currently about to make a decision on another health impact assessment that we're going to do, again, in partnership with the public health community. So that's a really good example of looking at how to integrate considering health outcomes, health equity outcomes as part of climate planning. A couple other things that we're totally involved in now is we did the Alliance Public Health Work Group in partnership with the New Jersey Society for Public Health Education, pulled together a convening last year, 2019, almost last year, that was specifically focused on looking at climate change as an exacerbator of health inequities. We brought together about 60 thought leaders from the environmental justice community, from the public health community, from the social justice community and the environmental community to come together and talk about, recognize the exacerbating effect of climate change on health inequities, and then start to, again, create a framework for how do we start to address those particular challenges. And so there's this document, which is not a great picture, is the summary, the outcomes of that convening. And you'll see we even use the signature photo that Surili mentioned. And then here, this NJ Adapt. Also, as Surili mentioned, the concept of being able to make tools actionable was an important part of the framework that the Alliance identified in the original Climate and Health Profile Report. And one of the things that we've heard from the public health community is that they really need access more and more to data that they can use to act upon. And so, Marjorie, if you could type the link into the chat box to get to the Climate Change Resource Center, this will show you where, in partnership with Rutgers University, there's been the development of data visualization, web-based data visualization and mapping tools. And this includes, some of you may know New Jersey Flood Mapper. Another tool is New Jersey Forest Adapt. And when I'm at the end of my slides, I'm going to show you an example of what we're referring to as municipal snapshots. So this is where any user can come on. You don't have to have fancy ArcGIS on your computer. You can come on and access data about your municipality or your county that can be helpful in terms of planning for climate change and public health interventions. Very recently, with the input of people in the public health community, we've added in new data because that data creates an opportunity. Then we think it's tied more explicitly to public health. So that includes adding in data such as the State Department of Environmental Protection's new data layer on overburdened community for the implementation of the state's new environmental justice law. It also includes having municipal snapshots of people with disabilities. It includes indicators about municipal distress, as well as location of populations that are not meeting the federal poverty level, but rather are asset limited and income restrained. And very importantly, we took the Centers for Disease Control Social Vulnerability Index, which many of you in the public health community are familiar with, and we broke it down to its component parts because we heard from end users that an index is very complicated to use. So again, I'll show you an example of that. But it provides you access to the kinds of data that Surili was talking about linguistic isolation, about race, about income, about lack of a car. And we also added in data about homelessness. So this is an ongoing effort, and I'll talk about that in a minute. I talked about the Act, Plan, Assess framework that the Alliance developed as part of the original Climate and Health Profile Report. And then I talked about the convening that we had in 2019, where we looked specifically at the exacerbating effect of climate change on health inequities. What the Alliance most recently, this was just posted 2 weeks ago, what the Alliance most recently did was prepared a white paper that identifies its framing that integrates the thinking from its work to date, including the Climate and Health Profile Report and its convening and listening to stakeholders on health inequities. This report also outlines, and I'll show you a slide in a minute, what the Alliance has identified as low-hanging fruit for action in New Jersey. And then also it identifies what are the specific action areas the Alliance itself is focusing on in 2021. So this is the framework that that new white paper, the January 2021 white paper, excuse me, outlines, right? Which is, we come to the original concepts from the Climate and Health Profile Report of acting, planning, assessing, supporting, and building capacity. But now we nest it in the concepts that came out of our convening on climate change and health inequities, is that these actions happen as part of engagement with the populations and the communities most affected by health inequities and most affected by the exacerbation of those health inequities by climate change. It includes advancing integrated multi-sector solutions, some of which Surili talked about, right? The solutions may very well reside in transportation or housing. The concept is that we address those solutions from a broad lens, and that there are many seats at the table for problem solvers. And then finally, the concept that equity, diversity, inclusion, and justice are the cornerstone of this effort, and that the solutions to the challenges faced by climate change impacts on public health are to address the underlying inequities in terms of housing, racism, income disparity that make certain populations more vulnerable to changing climate conditions and the sources of climate emissions. So this is the framework that the Alliance now operates under in terms of the work it's doing. So these are in that white paper, the January 2021 white paper. These are 4 areas that the Alliance work group identified as kind of low-hanging fruit for action in New Jersey. The first is the concept of integrating climate into considerations for long-term health planning, right? Integrate climate into health planning. And so more specifically, the work group identified the Healthy New Jersey planning process, which is the decade-long strategic planning effort for the State Department of Health that identifies priorities for health actions in New Jersey. And so viewing that as an overarching health framing that then informs local health planning as well, and looking for ways to integrate climate into Healthy New Jersey. The second is the reverse, right? Which is integrating health and health inequities into climate change actions and policies here in New Jersey. And particularly the Alliance pointed to the state's implementation of the Global Warming Response Act, which is the state's law that governs long-term planning, policy, and decision-making associated with emissions, climate emissions. And then the second are the provisions in Governor Murphy's Executive Order 89, which directs the development of long-term planning with regard to climate resilience and adapting to changing climate conditions. So essentially what the work group identified in number 1 is, all right, let's look at this long-term health planning and incorporate climate into it. And in number 2 is looking at the long-term planning for climate change policy and action in New Jersey and integrate health and health outcomes and health equity into those. The third item that the work group identified as providing sort of low-hanging fruit opportunities is rulemaking that the State Department of Environmental Protection is undergoing to implement the state's new groundbreaking environmental justice law. And the concept here is as New Jersey looks to identify what are burdens that are imposed upon certain communities to understand justice from that perspective, that climate could or should or needs to be considered a burden as part of that decision making. Because again, if you look at the earlier work of the Alliance, it points to climate as an exacerbator of those underlying inequities, whether that's disproportionate environmental pollution or racism or underinvestment in communities. And then finally, the fourth item that the Alliance Work Group pointed to as low-hanging fruit for action in the state is that the Centers for Disease Control is opening up their Climate Ready States and Cities program to invite new states to participate. And that those applications are expected in the spring. And so the Alliance Work Group pointed to that opportunity as a way to really build capacity in the state. But the intent is to build capacity consistent with this framework, right? So that all this work has been done based on research and evidence and engagement of many, many stakeholders over the years. And so we don't want to, we want to take advantage of all that work that's been done. And so that we're framing this on an action agenda moving forward. So finally, the Alliance's white paper that it issued last month includes priorities that the Alliance itself will be involved in. And so these are a few of them. So the first is to work with the Rutgers University team that's working on expanding data, web-based data tools for use at the state and local level in New Jersey. And specifically, that effort will include building a public health theme onto the tools, so that we will work with the work group to help us identify what are some of the data needs at the state and local level to be able to advance a climate and health agenda, whether that's health outcome data, whether that's data about social determinants of health, housing, transportation mobility, income, whatever, and make these data more accessible and easily accessible and automated through those municipal profiles to all of you. So that's a priority that the work group will be advising on. A second is to advise on an application to the Climate Ready States and Cities program. And so we're engaging in a conversation with the State Department of Health on that. The next is to continue the practice of using health impact assessment or rapid health impact assessment to inform climate decisions here in New Jersey. And as I mentioned, we are identifying an additional climate policy or pending or upcoming climate policy in New Jersey to be able to assess what the health outcomes and health inequity outcomes may be from that, or health equity outcomes. We'll work in partnership with Sustainable Jersey, which is a member of the Alliance Work Group and also a strong participant in the Alliance itself, to be able to inform Sustainable Jersey's ongoing efforts to build a culture of health gold standard, and to work with Sustainable Jersey to provide them with input and resources and connections to data tools that can incorporate health and climate as a component of their actions. We also discussed looking after COVID, because we know that this would be just much too much to add to the plates of health systems right now and public health communities. We look to build models of integrating climate change into county and municipal public health efforts, such as community health improvement plans. And then to also look at developing models for integrating, working with health systems to integrate climate change, not only into their own operations in terms of sustainability and energy efficiency and resilience in their own operations, but also in terms of working with health systems to identify how they can anticipate changes in health impacts and how their work can contribute to climate solutions for the populations that they serve. And then finally, the Alliance's last task, and as I'm saying this all out loud, I'm realizing, wow, we have a lot of work to do, is to provide input to the Healthy New Jersey 2030 planning process, to provide input for that on how climate change considerations can be incorporated into that. So again, the concept here is to think about climate impacts, health impacts from climate decisions, and how to factor in health into climate decisions. So before I stop here, let me just bring up this. So this is just gives you an example of the data tools that I mentioned that we're continuing to build. This even is outdated as of a couple days ago because additional data sets have been added. So this is a vulnerable populations municipal snapshot. I mentioned municipal snapshots of the fabulous town of Keansburg in Monmouth County. So part of what we do when we're building these tools is we identify what are the flexibilities that end users need where they want to play with the tools and use them themselves. But what we also hear from many end users is they want data sometimes automated. So this is an automated municipal profile, right, which provides the end user with lots of access to data about social vulnerability in Keansburg and demographic data. And so this gives you a sense of the kinds of data that becomes available. Again, there's even new data sets that have been added since we printed this off the web. So I'm just going to scroll down so you can start to see the kind of data that's easily accessible. And this is, what we've done here is we've overlaid these kinds of demographic data with Rutgers science about sea level rise projection. Part of some of the work that we'll be doing now that our priority is bringing in other climate hazards like temperature, precipitation, so that we'll be able to automate these kinds of data for use as well. Okay, so this I mentioned is the asset limited income constrained data developed by United Way. This is the data, points in time is homelessness data, housing stock. So again, we're always looking for the right sets of data that are needed by those that are working on solutions, whether that's the public health community or colleagues in other sectors. So I hope that was helpful. Thank you so much.
Thank you, Jean. And it's an amazing amount of work that's being done. I'm now going to ask all of our morning speakers to join Jean for a Q&A from the audience. In addition, we have some special guests who are joining our Q&A discussion. I would like to introduce them now. Kevin McNally is the executive board member and past president of the New Jersey Public Health Association and a member and co-chair of the Alliance's Public Health Work Group. Dr. George DiFernando is representing the local boards of health Association and is also a member of the Alliance's Public Health Work Group. And finally, if he was able to join us, Mr. David Henry, Monmouth County Health Officer, who's also been a very active member within the Alliance and also on the work group. Marjorie Kaplan has been monitoring the chat box and she will help moderate the Q&A. Marge, you're muted.
Hey, Matt, I
go.
can't hear.
You can't hear Marjorie?
Well, we can hear you, Marjorie.
Yeah.
So we all know the statement of the year is, hey, I think you're muted.
So I can start on the chat box. So I see that there's a question about the pending requirement for master plans addressing climate change. So I can answer that question. So there is a bill that passed the legislature that would require the development or the consideration of natural hazards as part of the land use element of a master plan, of a municipal master plan. A municipal master plan's land use element is one of the required elements. So that means this is a bill that's sitting on the governor's desk. And so if that becomes law, then the next time towns update their master plans as part of their land use element, they would be considering natural hazards. And so Marjorie and I wear another hat here at the university, which is to run a climate change resource center. And we put the link for that group in the chat as well. So we hope to be developing some guidance that can help towns with that. So I hope that answers that question. Let's see. Let's see. I'm looking for questions that someone other than I can answer. So there's been lots of questions about RGGI as a pathway for reducing greenhouse gas emissions, but there's also been opposition to RGGI from environmental justice advocates out of concern that doesn't improve ambient air quality in local communities. Surili, I guess I'm wondering whether this is something that you've heard from other states, maybe, in terms of issues associated with climate solutions and impacts on local communities, particularly air quality, versus sort of broader regional challenges.
Certainly. I don't have too much experience in this space, but I have heard anecdotally that when communities, especially environmental justice communities, take on approaches like RGGI, it's more, or initiatives like RGGI, it's more because of the devastating health impacts of air pollution rather than looking to other sectors to find solutions.
Thank you. And I think there's a question here for our friends in the New Jersey Public Health Association, which is, could you talk a little bit about how a local chapter relates to some of the great work that's happening at the national level?
I guess I can start on that one, and Don can chime in. The state affiliates of the New Jersey Public Health Association, and there's one in every state. In fact, California has two, divided north and south, are independent organizations affiliated with NJPHA. So we're not technically chapters, we're affiliates. And we've started at different times, and we each have our own local priorities in addition to working with NJPHA on the national priorities. I mean, we in New Jersey, our association, the founders of our association were among the founders of APHA going back to the 1870s. But we've always been a independent organization, and we focus on priorities that are based on what our membership thinks are our priorities here in New Jersey. As Don mentioned, we're all volunteer organizations, so it's our volunteers, particularly our active volunteers, who determine what our priorities are. So I would certainly invite, and I will put in the chat, anyone on this call who's interested in becoming more active in this area, particularly working with us on climate change, to become a member of NJPHA if not already. And if we haven't enough people there with an interest, we can form an active climate change working group within NJPHA.
Okay. Don, do you want to add anything?
Well, one of the advantages we have as a local organization is boots on the ground. We're in touch with what's happening in New Jersey and among our members. And as an organization, we have relationships that can be brought to bear. And we talked about partnerships. We talked about collaborations. It's going to take all of us in order to address this issue. Another thing that I think is worth considering is that in many ways, public health is local. And one of my thoughts in listening to the presentations and the comments is that as we talk about health in all policies, we have to find a way to bring that down to local officials, local decision makers. And I know there are relationships and conversations that local and regional health departments have, and hopefully those can be strengths in trying to get the buy-in that will be needed, because the impacts are going to be disproportionate. And not every community has the resources. Not every community is going to be up to meeting the challenge unless they plan for it.
Yeah, and so with that response, thank you both, Kevin and Don. So I think there's another question that I think we can throw to George and to David, which is, Don just mentioned, and I talked a lot about capacity issues. So just wondering if you could reflect a little bit, George and David, on some of the challenges faced in New Jersey, particularly at the local public health level, about being able to make sure that our Jedi warriors in the public health community have what they need to be able to lead work in this space.
So maybe this is George. I'll speak to from the Board of Health point of view, and then hand it off to David from the health officer point of view. Boards of health, which were established in New Jersey, we've heard about New Jersey's role in being where the American Public Health Association was established in the 1870s. The same thing is true with boards of health. They were established, and they were really established around environmental issues, water sanitation, and dealing with sewage, um, um, which were really environmental issues. And they grew out of that, and they were established to develop non-political or non-partisan expert advice for local communities, because just like now, back in the day, these environmental issues quickly became partisan or political with the big P issues. So local boards of health can still function that way. The challenge at the moment is local boards of health are being overwhelmed with basically COVID questions, as we all are. So the constant challenge in 2021 will be to maintain your attempt to maintain a focus on these longer range issues while COVID continues to drag us appropriately into the day-to-day response. So being able to manage that and being able to connect what you're doing on COVID, trying to maintain. And if I could disagree only slightly with some of the stuff we saw that Gene, that you put up, I'm concerned that we're not going to be able to wait to post-COVID to deal with this stuff, just because none of us really know when post-COVID is going to be. So we're going to have to wrap our brains around dealing with this, the environmental justice issues, the issues that Surili brought up while we're dealing with COVID, be that responding to the environmental justice legislation that was signed in 2020 and will be a jumping off point for trying to increase environmental justice in New Jersey, as well as many of the other issues. So local boards of health will be forced to deal with having both these issues on their plate and planning for all the other public health issues that are still out there. We're going to have to figure out how to do both things as we move forward. So that's from the Board of Health point of view. Why don't I turn it over to Dave to talk about what local health officers are doing in 2021.
Oh, thank you, George and Jean, and good morning, everyone. I guess I'd like to first start off and say, Surili, you had me at Jedi. So basically, you know, I'm all in. So, but basically, from the local public health department standpoint, George's comments in regards to resources, we need the boots on the ground to actually do this work. I know that we've been working with the state health department and climate change on trying to incorporate, you know, the low-hanging fruit of public health, you know, and we've been obviously distracted by the COVID concerns, but we still have to make inroads to touch upon the JEDI items. You know, one of the ways we're trying to do that, the state health department had a grant, or has a current grant out for finding vulnerable populations vulnerable to COVID. And basically looking at Jean's data from the slide that she put up, some of the same people that are vulnerable populations for climate change are also vulnerable populations for COVID. So there's a coming together where that a majority of the health departments in the state have this grant. So we can really, as a low-hanging fruit, incorporate some of this data, because trying to reduce health inequities is a problem from COVID, it's a problem for health, it's a problem for climate change. And what happens is we have to continually make inroads to nibble at this. And also when you're talking about health in all policies, well, one of the challenges we have is to actually be a source of, or trusted source of information to planning boards, zoning boards, when people are planning on developing along the coast or developing in the cities or the suburbs. They should always be free or directed to include us at the table as public health folks to talk about these issues of climate, health and equity, pollution items. Because being a former planning board chairperson, it's very rare you talk about public health issues, and we scared a whole lot of people when we started talking about public health at a zoning board meeting. So, these are examples of health in all policies. It's going to take all of us, and all of us can contribute to public health and moving and progressing forward. So I'll leave it at that, but thank you very much.
Marjorie, I'm turning it back to you. I think we probably have time for one more question.
Hi, sorry about that. Had a little bit of a technical snafu, but I hope everybody's good about that. There's a couple, actually, though, I want to just respond to a couple of the things in the chat that folks have raised. So I just want to make sure first of all, I want to thank everybody for giving us your suggestions. We will take them under advisement as we develop our tools some more. Somebody asked about whether or not there was whether or not we had, whether the HIA we did on the EMP had taken our recommendations into account. And I think the short answer to that is they did, to the degree that they were sort of overarching, right? And I don't think they got into the nitty gritty of some of the things we put in there, but it also has to do with implementation. And so I will say that there's been a new director of for clean energy equity that's been brought in. I thought I just mentioned that at the Board of Public Utilities. And so it seems like things are moving in the right direction. I think one of the last questions I think would be, I want to also mention, someone asked about the pending statute to the master plan for local master plans. So Jean, I don't know if you want to pipe in there, but it sort of gets to what David mentioned. There is legislation. I think it's sitting on the governor's desk waiting to be signed.
We mentioned that, Martha,
Oh, okay,
while you
I'm
were
sorry.
struggling with your tech problem.
All right,
Yeah.
apologies.
Okay.
Apologies. So I guess maybe somebody asked a question. I don't know if you asked this already. In what ways has your work in this arena been made easier or harder with an increased acknowledgement of the need for justice, equity, diversity, and inclusion? I don't know if you had been asked it, so maybe why don't we end on that one? If anybody wants to take it.
I can start. Thank you for the question, first of all. I think it was Lisa. So what's been easier is that it's, the times, 2020, the convergence of these crises have made it easier to talk about Jedi, has made it easier to talk about racism. More people are self-educating and becoming aware of challenges, and what we're talking about in terms of the health impacts are the symptoms. And some of the policies that are put into place today without the reimagining of Jedi are only bandages to the real upstream and root causes of why our society has this great gap in terms of health disparities. So having the conversation, making it more normalized, is a huge benefit to the times. The challenges rest in not everyone has the same baseline understanding or comfort level in the conversation. And so I like to always say, we're all going to show up to these conversations in the way we feel most comfortable, and that we're going to be respectful and listen. And with Jedi in acknowledging it makes us remember that we need to talk about it. But the next step after these, declarations of racism as a public health issue, or statements that we need to do more around health equity, can't be the end of it. And I like the way I think Jean put it, was that we're going to focus on it. We're going to make sure this is integrated into New Jersey's planning. And I think that's key because it needs to be a central focus. I know early on, we all talked about health equity lens, right? A lens of how somebody who has prematurely gotten reading glasses. I have the option to take them off, you know? So similarly, we have the option to take off our equity lens. And we need that to not be an option anymore. So that's where some of the benefits are coming. We're having the conversation. It's been tough. And we're also still falling into the traps of politicizing the conversation and the benefits and the risks, the burdens and the benefits that I talked about a little earlier. We're still fighting about what is commonly good, who are we benefiting when we're creating policies, what sectors, what capital, what economies are we benefiting? And it's not about that anymore. We're seeing people dying in huge numbers from these converging crises. And it's the same people, the people that contribute the least to it, the people that need the most assistance in terms of income or wealth or resources, the people that are constantly marginalized or divested from their communities, their schools, their sense of self. So how do we go, again, upstream, to not put a bandage on it, on the problem downstream, but really focus on JEDI upstream, where we can integrate and put this at the center of all of our conversations moving forward.
Thank you. Anybody else want to?
Marjorie, I think what I would add to your question and to Surili's comments is that I think that by drawing the intersections between climate and some of these other issues regarding inequities and social justice, is that it does allow us to bring more voices into the conversation. And in particularly, I think it's really allowed a strong ability to bring the public health voice into the conversation. And so I posted in the chat box two things. One is, and I want to give the State Department of Environmental Protection a shout out, because they provided support for us to work in partnership with them, us meaning Rutgers University, myself and Lisa Auermuller, to put together a web-based training on how climate resilience planners can better understand how to better integrate and address the needs of marginalized populations as part of climate resilience planning. And the public health community has a strong voice in that work. And then second is the final report on that project, which again, also draws some really strong connections between health inequities and climate that I think outline some good steps forward. So those are both in the chat too.
And I would just jump in very quickly that this is brought back to the fore what we in public health have been saying for decades, is that all these problems, the social determinants of health, all these problems are public health issues. As Dr. DiFerdinando mentioned, the source of public health, beginnings of public health, are environmental health. And we've gotten away from that in recent years. If I can just talk from my own experience back in the 1990s, when I was the coordinator of childhood lead poisoning prevention at the State Department of Health, it was very clear that the source of this problem was it's not a health problem. It's the health manifestation of a housing problem. And the source of childhood lead poisoning is poor housing and poor maintenance of housing, because of which are very much related to the socioeconomic factors of the housing and the communities with which these children lived. So it's a broader area that need to be addressed, not medically, but from a housing perspective and a holistic city planning perspective. So we're recognizing that we need to address health and public health in all policies. And all these crises have just reinforced that and made it visible to the other decision makers.
I know we're out of time, so I'll say amen.
Yeah, and Jean, I don't know if we put the bit in the chat box, but this what Kevin mentions reminds me of the work we did on energy and distribution of benefits on clean energy and climate programs, and we learned quite a lot similar to what you're saying, Kevin, in which these things need to be tied together.
So we are at the actually 12:01 mark. I want to thank the participants and the panelists for their wonderful insight, and also thank them personally as being our healthcare heroes, not only from the day-to-day, but the continuing dedication to your field. Just a few notes. This event will be posted on our website in a few days. I'd also like to invite you to mark your calendars for our next event in this series, Thursday, February 16th at 12:30, featuring several members of the Providence, Rhode Island Racial and Economic Justice Committee, along with Lee Bamberger, Providence Director of Sustainability, who will present Providence Innovative Climate Justice Plan. We will send a notification as soon as the registration opens. Thank you, and this concludes our event for today.